Hi everybody, so I just wanted to create a short video on how I create my first aid travel kit for when we're on vacation. I think this is so useful to know because this is something that you can put together as well when you are traveling, going on vacation. Right now we are in Maui, Hawaii, and before we begin I'm just going to quickly show you the view. It's absolutely gorgeous. As you can see, clear skies, blue water, the perfect day to go out for a swim. And especially when you're going out on these adventures and you're swimming, hiking, canoeing, there's always risk for injuries, and there's always a risk, right? So you want to be prepared in case that happens. Of course, we always want to try to avoid that as much as possible, but I always feel like being prepared is really important. So let me show you what I put in my first aid kit. Now, all of the things that you see here, you can buy from your pharmacy, and you can also get some of the things from the dollar store as well. I usually put everything in one or two of these travel kits. As you can see, they look like makeup bags, and you can get this from the dollar store or you can get this from any pharmacy. They have these, which is great. I also have a really nice travel kit here as well. It's like the size of a makeup, it's just like a makeup kit as well. So this is where we keep our masks, as you can see, and we also have some gloves as well, because the last thing you want with a cut or an injury or with somebody who's bleeding is to use your bare hands. It's always important to wear gloves, especially if you're suspicious for any kind of blood contact. So this is really important to have gloves on hand and masks on hand. So we have both of these, and I have this in a nice little pack, and I carry this in my handbag, which is really convenient. So the other things that I have in my first aid kit include these two types of bandages. So I always carry two sizes. One is a little larger, as you can see, and then I have the smaller size as well, which is great. And this depends on how big or small your cut or your wound is, so it's important to have both sizes. I always carry hand sanitizer, especially when you're going in and out of restaurants, you're traveling on a plane. You want to sanitize the seats and the armrests. So this is really important to have, right, for surfaces. This is not necessary, but I also carry antiseptic towelettes as well. Sometimes it's easier to use these than it is to use the hand sanitizer, and a lot of airlines are now passing these out as well to clean the seats before you sit down. So these are nice to have on hand. Always carry alcohol. This you can get from any pharmacy. You can get them by the pack. Alcohol prep pads, so important to clean surfaces. It's antiseptic, especially when you have wounds and stuff like that, to clean off the surfaces. These are excellent. So you want to have alcohol pads. The other thing that I have, which is not necessary, are these unscented baby wipes. Hypoallergenic. Again, it's not necessary, but I find these really useful. This doesn't obviously fit into my first aid kit, but these are useful to clean off surfaces as well. So I have this. And then as you start accumulating materials for your first aid kit, they kind of stay there, and then you can continue to use them. Now, when it comes to injuries, cuts, wounds, especially when people are profusely bleeding, one of the things you definitely want to always do, rule of thumb, is to apply pressure. Applying pressure helps with wound healing. And so a couple of the things that we have are these rolls. So this is like a gauze roll that you can apply. This is highly absorptive, especially if a person is bleeding, and it can also be used to wrap around an injury to apply pressure. And so this is a nice gauze roll. The other type of pressure roll that I have is this, and this is a little bit more adhesive. As you can see, it sticks, and it's very good for applying a lot of pressure. So say you have a cut or an injury and you apply a Band-Aid, you can apply this over top the Band-Aid and roll it around the arm or the leg to apply a good amount of pressure to hold that Band-Aid or gauze into place. So this is very effective, and this is more so of like a pressure kind of roll. So see if you can find this in your pharmacy. This is always good to have as well. I always have tape, of course, right? You want to have tape to secure anything in place. There are skin tapes, and then there's more of this kind of like plasticky tape. The skin tapes are a little better and less harsh on the skin, but this is all I had, so I put this in my travel kit. The other thing you always want to have is an ACE wrap. ACE wraps are so cheap, and they're so important to have. These are really good, especially if you have joint and muscle injuries or tendinopathies where you injure your tendons and you want to secure that joint or immobilize that joint to allow some healing to occur. These are great, and it also helps to reduce pain as well because it immobilizes that joint. So it's really important to have these ACE wraps, and as you can see, it has the sticky kind of Velcro piece at the end, so it can hold itself. You don't need a clip or a Band-Aid for this, or like any tape for this. So these are great to have. Now you have two types of Tefla gauze pads. One is the adherent one, and the other one is the non-adherent one. This is kind of similar to the roll that I showed you over here, but this is more so like a 4x4 or 4x3 gauze pad, and it is highly absorptive, but it does stick to the skin as well. So for example, unfortunately, my husband went swimming and a big wave hit him from the back and caused his head to go face down and his nose to rub against the ocean floor, and there were some rocks there, so he had some bleeding from his nose. He had an anterior nosebleed, some vessels ruptured in the front of his, or in the anterior part of his nostrils. And so the first thing I did was I opened this up, I cut this into small pieces, and I packed his nostrils with this gauze pad, which really helped to stop the bleeding. And on top of that, we also applied some pressure to the nose from on top as well. So again, applying pressure is so important to control bleeding, and then he was all set. Having this kind of like gauze is great, these small pieces of gauze, and this is adherent. So you don't want to apply this to a cut, because the last thing you want is if you apply this to a cut and then you remove it, it may pull the skin back as well as it's healing. So you don't want to use this for cuts. What you do want to use for the cuts are the non-adhesive gauzes, and these are nice as well. They're absorptive too, but they don't stick to the skin. So these are great for absorbing blood, but also to help with healing as well. And you can apply this directly to the skin and to the cut as well. And both of these are sterile. Okay, so that's another good thing about this. The other thing that I absolutely love is iodine solution. And you can buy this by the bottle, or you can buy these as like Q-tips. These are Q-tips, and they have iodine on them, and these are just so excellent and so convenient. You can get this from any pharmacy. Iodine is one of those things. It works like chlorhexidine. It's antiseptic, it's antiviral. It helps to reduce the viral load on the surfaces. It prevents infections, and this can be used to clean around any kind of injury or wound or abrasion or cut. So this is excellent to have if you can get your hands on this. I'm a big fan of iodine, and this is something that we also use for surgeries as well, pre-surgical kind of cleansing of the skin. This is excellent. The other thing I have is this pulse oximeter. Now, especially with the COVID pandemic, we've got to be really careful when we're traveling, especially monitor for signs and symptoms of shortness of breath, difficulty breathing, wheezing, not being able to take that full breath in. So this pulse oximeter is just fantastic. And as you can see, it's small, it's compact, it's portable. We got this from Walgreens Pharmacy. I think it was like $40. And really, you just slip your finger on, and this will give you your oxygen level and your heart rate as well. Now remember, your pulse ox is telling you your blood carrying capacity of oxygen, and your hemoglobin is responsible for that. And ideally, you want your oxygen levels to be anywhere from 95 to 100%. Anything below 90% is concerning for hypoxemia, and that means you've got low oxygen levels in your blood, and then over time that low oxygen level can cause injury to your organs, including your heart, your kidney, and other essential organs. So you want to try your best to try to have those levels between 95 to 100%. Anything below that, below 90 especially, is when you start to worry, and you really should be seeing a doctor for higher level of care or going to the emergency department. This will also give you your heart rate as well. And ideally, you'd want to have a blood pressure machine to know what your blood pressure is as well, but you can't have everything when you're traveling. So this is good to just check your heart rate. Normal heart rates, can range. Everybody has their own baseline. My husband's heart rate tends to run in the 60s, mine tends to run in the 70s to 80s, but naturally and generally, people's heart rates will run anywhere from 60 to 100. Anything above 100 is called tachycardia, and that's worrisome, and anything below 60 is called bradycardia, and that's worrisome as well. So you want to have that on hand. I think this is just an excellent device to have. The other thing we carry is a thermometer, right? And so this is pretty self-explanatory, just to check for fever, especially if you're having COVID symptoms, shortness of breath, difficulty breathing, you're feeling febrile, always check your temperature. And true fever is anything above 100.4. Okay. I always carry medication as well, and it'd be nice to have antibiotics on hand, but you can't always have that on hand. But I do carry topical antibiotics. So bacitracin is a really nice one to have, especially for skin infections and stuff like that. And this is a triple antibiotic which has bacitracin, neomycin, and polymyxin B as well. And you can get this again from any local pharmacy. So for cuts, injuries, abrasions, wounds, open sores, this is excellent to apply 2 to 3 times a day to the affected area. Of course, you want to keep the area as dry and clean as possible. And so good to have this on hand. Now, medication-wise, Advil. Advil, and Tylenol. I don't have Tylenol on me right now because we used our Tylenol up, but Advil is excellent. And Advil is good for things like inflammation. It's anti-inflammatory, right? Non-steroidal anti-inflammatory medication. It's good for inflammation, and it's excellent for pain. So if you've got bruises, contusions, injuries where there's a lot of swelling and pain and redness, this Advil is excellent for that. And the same thing goes for things like naproxen, ibuprofen. These are all NSAIDs, right? So you can have this in your kit, and you don't need a lot. We only have 10 tablets, and it's good enough for our 1 week trip, okay? Tylenol, remember, is an antipyretic. It's not an anti-inflammatory. So Tylenol is excellent for things like fevers because it's an antipyretic. It can help a little bit with pain, but for pain, Advil is usually preferred, especially if you don't have any kidney problems. Advil is usually preferred, okay? Want to make sure you take this with a lot of water. And the other thing I carry with me is this Albuterol inhaler. Albuterol is a quick-acting spray that you inhale that opens up your lungs immediately, and it's very good for people who have asthma. And so I have asthma, cold-induced asthma, and one of the things that we did on our trips is we went hiking up this mountain, as you can see, and this mountain is almost 10,000 feet high. We went up to a 10,000 feet altitude, and it was extremely cold up there. And so I started to have some wheezing, difficulty breathing, and all of that stuff. So definitely important to have the Albuterol inhaler on hand. And we were also at a very high altitude. So the high altitude plus the cold caused the respiratory issues, and the Albuterol worked immediately, right? Another thing that people can develop at high altitudes is something called mountain sickness. So you have to be really careful about that as well. Mountain sickness or altitude sickness can usually present with, headaches, difficulty breathing, shortness of breath, some confusion. And so if you're having those symptoms, that's a sign that you should probably go back down to a lower altitude, which is what we did as well. So that's the Albuterol inhaler. Usually the dosing for that is 2 puffs every 4 hours. Every 4 hours, and do not exceed more than 3 times in a day, okay? Because it can cause your heart rate to go up as well. So that's how you use the Albuterol inhaler. And then I always carry an antihistamine. Antihistamine is so important, right? Especially if you've got hay fever, you have allergies to pollen, dust, and all of that stuff. So, an allergy medication is the way to go. This can also help with, rhinitis, so allergic rhinitis, allergic conjunctivitis, so itchy eyes, runny nose, and all of that stuff. Some people choose to also travel with Flonase, which is a nasal spray that you can get over the counter with a letter prescription. And I highly advise that. I think that's a great idea to carry as well. But especially for like bee stings, bug bites, where you have localized itching and pain, this can also help with that as well. And I also carry Benadryl too. Benadryl is great. Just remember, Benadryl is a little sedating, so you have to be careful with Benadryl. It can make you a little sleepy, but it does help with some of the symptoms that I just mentioned before as well. I also carry these N95 masks because of COVID. We had about 6 of them. We used 2 of them already. These are really difficult to wear all the time. We basically wore these at the airport and while we were on the plane, but it was extremely difficult because it was a 6-hour flight over the Pacific to get to Hawaii. And we had to wear this during the flight, but it was pretty tough to keep this on for a full 6 hours, but we tried our best. So N95 masks are really important. And then you can always double mask as well. And then I always carry my stethoscope. Now, you don't need to be a physician to carry a stethoscope. You can anyone can get their hands on a stethoscope from any scrub store. Some pharmacies will carry them, but I find that the scrub stores have excellent cardiology 2 and cardiology 3 stethoscopes. And I mean, this is just such an essential tool. It can help you listen to lung sounds to determine if somebody's having wheezing or any rales or rhonchi or any crackles or any fluid in the lungs. This will also help you listen to heart sounds as well, to make sure that no one's having like an irregular heartbeat or a fast or slow heartbeat. So having a stethoscope on hand is just extremely helpful. So that's basically it. I know that seems like a lot, but once you put all of these things into your kit and your kit is set, none of these things really expire except for the medications. But once your kit is set, it's set, and then you can just basically take it with you on any travel destination. So I think it's very helpful. I hope this helps. Thanks so much.